Annual doctor checkups can be nerve-wracking and inconvenient, but after hearing my speech, that will hopefully be changed. Why visiting the doctor yearly is important. In December of 2009, my grandma died from uterine cancer. That is why I am here today to talk to you guys about why annual doctor checkups can be beneficial to your health. I have been interested in the medical field for a long time now, but recently I have started to study how visiting the doctor yearly could be more beneficial to my health. Did you know visiting the doctor at least once a year could potentially save your life? A Monroe motivated sequence is structured as a need or a problem, then comes satisfaction, and finally the benefit. For my speech, the need or the problem is that people are not getting annual doctor checkups. The satisfaction would be them getting the annual doctor checkups. And lastly, it could potentially save your life. Regular or annual doctor checkups that could potentially be life-threatening health issues can be cured if caught early on. Studies show in 2019, approximately 28.9 million didn't have health insurance. And out of the 28.9 million that don't have insurance, estimated that about 5 million die yearly because of poor health care. This is a problem. If you are looking for health care, the Affordable Care Act, also known as Obamacare, is perfect for you. They help to make affordable health insurance and expand the Medicare program. Then there are people who come up with excuses to get out of doctor visits. Excuses like, I'm healthy, why get a checkup? And I'm too busy, and there's probably nothing wrong, it will go away. And the list goes on and on. Now on the screen, you will see a chart. This chart shows symptoms or signs of things to look out for. If you come across one or multiple of these signs, then you should make an appointment for the doctor or go into the ER if it is an emergency. This first diagram was made by Phoenix Family Medical Clinic, where they posted an article, Top 5 Signs You Need a Same-Day Doctor's Appointment. The second diagram shows you the number of doctor visits per 100 person by sex and age. This diagram was created by CDC in January 2012. In the article, Preventative Care Rates per 100 person by sex and age, United States 2012. Now that I finished up informing you about the problem, now let's move on to the satisfaction. Do you get annual doctor checkups, but not sure what needs to be checked every year or if there's anything wrong? Here is the most common things that need to be checked every year. This differs from person to person. Women can expect a yearly pelvic exam and breast exam. From a pelvic exam, they will be testing for STD, PID, which stands for pelvic inflammatory disease, and cancer. A breast exam looks mainly for breast cancer. A male's yearly checkup may consist of a prostate or a testicular exam. While both the prostate exam and doctors will be looking for lumps or increase in size, as it could be a sign for cancer. You can do the same, you can do some quick exams on yourself every once in a while, but the doctor will be able to find something that you cannot feel or visually see on the outside if there is something. Doctors use tissue samples, high-tech imaging, surgical exploration, urine samples, and many more different ways for doctors to find cancer. Heart disease, diabetes, etc. We finished talking about what needs to be checked every year. Now let's move on to the benefits of seeing doctors yearly. Have you been in a situation where you were diagnosed with something that could be cured early on? Catching a disease or diagnosis early on can potentially save your life. A good example of a disease or diagnosis would be cancer, diabetes, or heart problems. I will be talking about cancer. In 2020, 606,520 people died from cancer. If cancer is detected in early stage, which is very easy, 80% of patients can be cured. This was a quote said by Times of India on November 6, 2009. They reported an article, 80% of cancer cases curable if detected early. To review what we have learned about this speech. It is structured as a Monroe motivated sequence. Need, satisfaction, then comes benefit. The need or the problem for my speech is that people are not visiting the doctor for checkups annually. Then people getting the annual checkups would be the satisfaction. And finally, the benefit is that it could potentially save your life. Now that you know the importance of visiting the doctor annually and knowing that it could potentially save your life, maybe visiting the doctor annually isn't all that bad.